Hi, I'm Dr. Robert Fallis, and I'm here just to kind of go through something that a lot of men really struggle with, and that's how to do an injection with testosterone. We'll just show how easy it can be. Today, my subject is John the Orange, and we're going to show how we inject into John. So before we do anything, we have to prepare the area. So you can use a cotton ball dipped in alcohol, or if you have a cotton swab, you can swab the area. The area that we most often use for injections of testosterone is the anterior thigh. Between the knee and the groin, about halfway, the anterior thigh is the front of the leg, the front of the thigh. Just to show you what we're using, it's a small tuberculin or diabetic syringe, 1 cc, so you can see that the designation goes all the way from 0.1 all the way to 1 mil. Normally, we're going to be using 0.5 or 1. That's the most common in the testosterone that we use. Also, the needles, you need a little bit of a larger needle to draw because the testosterone liquid is a kind of an oil-based liquid. It's quite thick. So usually we use a larger needle initially, and this is a 21 gauge 1-inch needle. So we pop it out, put it on the syringe itself, and take the needle out of the protective sheath. From here, the secret is to actually fill the syringe with air, and when you flip over the testosterone bottle, you're going to actually inject into the rubber stopper and fill the bottle with air. That makes it a lot easier when you draw down, and you can slowly withdraw the testosterone medication, and you can see it slowly filling up the syringe. Today we're going to do the 0.5 mil, so I'm going to then bring it back up to 0.5, and you can see the bubbles coming out into the liquid as we're clearing them. There's no problem with a little bit of air. We just don't want a lot of it, so we try to clear as much as we can. But you can see now that I've taken the syringe. It's filled up to 0.5, so half of a cc. You can see I still have the syringe, the drawing up syringe, but that's not the syringe we're going to use to inject into our muscle, into our thigh. So I'm going to now take this, recap it really carefully so you don't stab yourself, and then take that and discard that. I'm now going to take a smaller needle, which is a 25 gauge 5/8, and we're going to now put the syringe onto that needle. Much smaller needle, doesn't hurt when you inject, and in fact it's really tiny. The secret with injecting testosterone is once you've cleaned the area, the secret now is to go straight down and directly in. This is going to be the thigh. You're going to go basically straight in, and then you slowly inject. This is really thick, so you have to do it slowly. And if you do that, then you won't have any leakage around the cap. By doing that, you can see I slowly taking it down. And then when I get to the end, I'm actually going to leave the needle in for about 30 seconds to 45 seconds. By doing that, when I take the needle out, there's much less chance of any blood loss. So sometimes you'll get a drop of blood after that, but usually you'll get nothing. Once you're completed, you just take it out, put it aside for a moment, and then some people will get either a tissue or use their gauze and just massage the area. It just kind of spreads the testosterone underneath the muscle, okay, and underneath the skin. And also, by doing that, reduces the risk of any kind of bleeding onto the skin. And it's as simple as that. It takes literally 2 minutes to do it. The most important part of all of this is capping things safely. So you've got now 2 needles and a syringe, and you have to dispose of these safely. If you don't have something to put them in that's safe, you can put them in a can or a bottle that's hard that the needles can't go through, and then you'll have to dispose of those in the trash.